22 years old and I've been riding horses all my life. I started mainly wanting to race ride when I was 16. I went to finish school and then I went to British Racing College. The injury came about 2 years ago when I was riding my own horse in a point-to-point and I came to the open ditch and he went to run out and luckily I got unseated and I landed on the floor and I was on the floor for about 10-15 minutes and I had hit my shoulder and my ankle, but I managed to get up and pass the doctor fine. I then kept getting my shoulder half dislocating. Throughout years it kept coming out, but I did a bit of physio, tightening muscles, and which did help it to stay in. And beginning of this season I've won a couple of races for Paul Nicholls and Rose Loxton, and it hadn't come out until at Cheltenham when I was jumping the second last. When I came here to see Simon and he was like, well, I've operated on rugby players and they have come back, so we'll just give it your best shot. And it just put that little bit of hope in there that there is people out there that can help you out and believe in you still after all the damage that I've had done. So I wouldn't be able to sleep with my arm up or anything because it would just come out, you could just feel it always constantly. I wasn't in constant pain until it came out. It was fine. If it came out, it was agony, my whole arm would go dead. But it was always, you had to think about what you're doing and you can't do this or I can't do that. And it's now such a relief that you don't have to think about it anymore.
Dislocating shoulders are actually quite a common problem that we as specialist shoulder surgeons deal with. And most people, when they dislocate their shoulders, damage the ligaments. So they rip the ligaments off the edge of the bones. And that then means they have a looseness or weakness in the shoulder, and the ball which slides forwards on the socket and normally gets stopped by the ligaments doesn't, drops over the edge and the shoulder dislocates. And so that's a common injury in men and women, often associated with sport. Now, if the problem is that they've ripped the ligaments off, mostly all we have to do is to put the ligaments back into place, which then stops the ball sliding off the socket and the patient ends up with a good result. So it's surgery that takes a bit of time and it's a long rehabilitation, but it's very effective. Unfortunately, what Harriet had done was a much more complicated problem where, as the ball had come off the edge of the shoulder socket, it had knocked off a corner of bone. So she'd reduced the size of her socket by about 30%. So a third of her socket was missing.
So I had an open lateral procedure. The top of the T that holds my shoulder in, I had broken the top of it off, and the ball of my shoulder, I had knocked 30 to 40% off the ball as well. So Simon said, on my shoulder there's a bit of bone that you don't need and it'd be better to get it out of my shoulder because it's still alive. So he would cut that bone off and then reattach it to the top of the shoulder teeth, and he put 2 pins in it to hold it back in place.
And the problem with that is if you then just try and tighten up the ligaments a bit on something where 30% of the socket is missing, it just simply doesn't work and the ball still drops off the socket and the shoulder keeps dislocating. So one of the things that we know is almost the worst things we can do is to do an operation that doesn't give the patient the result that they want. Because not only is the patient unhappy, but they've then had the problems of having an operation and recovering from it, and they're often genuinely worse off rather than better. So if we have someone who has a complex problem like Harriet's, the most important thing is to define exactly what the problem is so that we can then plan and design an operation that is likely to give her the result that she needs. And in her case, she wants to go back to a high demand sport of horse riding, and what she doesn't need is to what happened to her before, for the shoulder to dislocate in the middle of a race, and it's not a lot of fun for her. So we know from just the original x-rays and MRI scan that she had damaged the bone on the socket, and the key was really trying to work out how badly that had been damaged and therefore what our options and choices were for trying to rebuild the socket. Now we're looking at the scans where the radiologist has been able to give us a kind of three-dimensional picture, which is very nice, and we can rotate round the shoulder blade here, and here is the ball. But you can see that as we do that, we can't get a completely clear view of the shoulder socket because the ball is in the way, and that makes it harder for me to work out what is going on. So the clever new bit of technology has been created by actually removing the ball. So we're now looking at just the shoulder blade, and we can rotate the shoulder blade round and effectively look at the socket as if the ball isn't here. So here is the socket, and the socket should be oval in shape like this, and all of this bit here is the bit that's disappeared. Now what I was able to do then was to plan to use this piece of bone up here, remove that, and then move it down to fill in that gap in the socket with a piece of Harriet's natural bone.
When I found out which surgery we were going to do, I was literally like, just kick on, literally as soon as we can do it, and the quicker I can be back on a horse, it'd be amazing. I woke up after the operation, and my first thoughts were literally, how did it go? Like, did it work? And Simon's like, it was better than what he thought. He could have even operated on another person that day. What was really good to hear. And it just, the whole recovery afterwards, they put a nerve block in my neck. So when I woke up, I had no pain at all or anything. The nurses were really nice and looked after me. And the food was lush. I loved the food.